Tranexamic acid, most commonly known as TXA. You might also hear it by its brand name cyclocapron or Lystita. It is a hemostatic agent, might also be considered antifibrinolytic and a plasminogen inactivator. Any of those, you put in any of those classes there, does it? Those are all pretty similar. Mechanism of action, so what it does, it prevents plasminogen activation, which inhibits plasmin from then breaking down fibrin in blood clots. So overall, whenever the body starts producing blood clots and in response to massive trauma or whatever, eventually the body also will break down those blood clots and then recycle and reuse all the byproducts, all that good stuff. So what this does is just prevents the breakdown of those fibrin in the blood clots. So it helps with bleeding, and the biggest thing is whenever you've lost a bunch of blood, your clotting factors that are in your blood there might not be enough of them, or you might have dumped a couple liters of saline into somebody and they're really diluted, any of those things, and so there's just not enough clotting factors to help with that and preventing that breakdown of blood clots. So this TXA is a supplement for that, and so then will help prevent any further hemorrhage and slow that down. That's kind of how it works. Pregnancy class for it is C. Indications can be hemodynamic compromise from severe hemorrhage, less than 3 hours old, and that's important. Less than 3 hours old as of the most current research is the only time we're going to give it. So what are we looking for? We're looking for heart rate greater than 100, 110, something like that. Systolic blood pressure below 90, something that shows us that they're in hypovolemic shock. And also, massive transfusion needed, suspected. So whatever those signs and symptoms might be that tell you that they're going to need blood, they're going to need a lot of fluids, all that good stuff. Contraindications, injury older than 3 hours. And the next one is kind of a relative contraindication, history of pulmonary embolism, DVT, or other thromboembolic disease or disorder. Thromboembolic disorder. And so the studies that have been done so far don't show any increase in risk for PE or DVT or strokes or any of that at this point. But there is, because it does increase blood clotting in the body, there's always that chance for that adverse reaction or whatever of getting those blood clots, increased blood clots in the body. So that's why we always stay mindful of it, but it's not necessarily a contraindication or an adverse reaction, but it's just something we want to keep in mind. So another adverse reaction might be a headache or abdominal pain. That is possible. Overall, though, if we're given this, it's with massive trauma, lots of hemorrhage, that sort of stuff. So, drug interactions, hormonal contraceptives can interact with it, and then other clotting factor complexes is possible as well. They're working on different things for like hemophiliacs. I think they're doing trials and stuff for also giving this with hemorrhagic strokes and trying to expand the uses of this drug beyond just trauma, which is how we do it now. Nosebleeds, that's another thing they're trying to expand on. So typical adult dosing is going to be 1 gram IV or IO over 10 minutes, and typically you'll just mix that in 100 milliliters normal saline bag and then run it in over 10 minutes. Pediatrics, over the age of 10, you're going to give 15 milligrams per kilogram IV IO over 10 minutes, and again, you're going to mix that in the 100 mils normal saline. According to the book, if you look at the book for the pediatric dose, it says not recommended. The Oklahoma State protocols is where I got that dosage of over the age of 10 and use 15 milligrams. So, of course, always follow your own local protocols. Onset, don't really know. Peak effects, don't really know. We just know it stays working in the body for 7 to 8 hours, possibly. And there's no other real special considerations with this. All it does is, the only design of it is to help increase blood clotting with massive trauma and massive hemorrhage. And so hopefully they stop losing as much blood so we can, help resuscitate them and stabilize them.